Okay, so today we're going to talk about what you might need to think about when you need to help somebody clear secretions using invasive suction techniques. So if you've tried to help somebody mobilise secretions and you've tried to utilise different clearance techniques and they've been ineffective, you might need to consider other techniques to help to clear those secretions from the patient's airways. So if somebody has retained secretions, you can use adjuncts, but where somebody has an ineffective or very weak cough or they're already fatigued, it may be that they need additional help. So you would choose to suction somebody only when they've got retained secretions and their physiology is affected. So it may be that their oxygen saturations are dropping below the required normal range, and it might be that their oxygen requirements are increasing because those secretions are there interfering with gas exchange. So that's why you might choose to suction somebody when you've tried other things and they don't work. So the things you need to think about are to have all the equipment ready once you've decided that clinically that person needs suction. And so there's various bits of equipment that you would need to make sure that you had. So there are gloves. So you've got just your normal gloves that you would find in the box available on the wards, but you also need some sterile gloves that you would use as a second pair to try and maintain as aseptic or sterile technique as you possibly can, because you're introducing foreign material into somebody's internal ecosystem. You also need suction catheters. So they come in a variety of sizes, and the size is usually indicated on the packet, and you also have colour-coded labels, so they can also, once you get used to the sizes, tell you at a quick glance which size you've got. So the 14s tend to be green, and the blacks tend to be a size 10, and the white one, which we have an example of here, is a size 12. Okay, so they're the different adult size catheters that you might come across in practice. Other things you need to think about is, have you got a working suction unit? So there may be one if you're in a hospital environment that's attached to the back of on the wall at the back of the patient's bed, or sometimes in community, patients may have a portable unit that looks something like this, which is plugged in to the power source, and you just need to make sure that before you use everything that when you switch it on, that it's got adequate suction pressure to be able to clear those secretions. So I'll give you a demonstration. I'll switch this on, it's quite noisy. Things that you need to be aware of is to absolutely make sure that the suction pressure isn't too high where you're going to damage somebody's airway. So the recommended suction pressure is 20 millimetres of mercury. So make sure that you're not going over that when you're trying to clear secretion. So I'll just switch this machine off because it's rather noisy, and we'll go on to think about choice of airways. Okay, so most trusts now recommend that you try nasal suction first, and a nasal airway is inserted to allow you to do repeated suctions without causing repeated trauma to the nasal mucosa. If you are struggling and it's appropriate to use an oral airway, if a nasal airway is difficult, you can use an oral airway instead. So the nasal airways look like this, and they come in different colours, and again they're colour coded for the size of the patient. So the way you would actually choose the right size for your patient is to measure the distance between the nostril and the tragus of the ear, which is this little flappy bit that sometimes people have pierced. So if you choose to measure from there to there, that measurement will give you the size of the airway. So if I just demonstrate for you here, you can see that this is going way past the tragus, it's too big. So if we try different size, which is slightly shorter, you can see that that's just from the nose to the tragus. So that would be the ideal size for this person if you needed to suction them. If you were struggling to go nasally, you could choose to go orally, and so we have what we call a Goodell airway, which looks a bit like this, and again they come in different colours depending on the size that you need for the patient. Okay, so again, your measurement for this, for the right size, is to go from the corner of the mouth to the earlobe. Okay, so whatever size fits that distance is appropriate for your patient. So again, if I decide to try and show you this, we go from the corner of the mouth to the earlobe. That's just going a little bit beyond the earlobe, so we might try a different size to see if that's more appropriate. That one is just a little bit short of the earlobe, so I'm going to try this pink one, and that looks a better fit. Okay, so again, that's how you decide which airway to use and how to size it.